3, 2.
Hey guys, Dr. Joe here. Today we're talking about, gotta wait till my coworkers there. Today we're talking about understanding your digestive system. A lot of times, if you're a regular listener, I talk about the stomach and how the stomach pushes up against the diaphragm. But we're gonna go a lot more in depth. How the stomach actually works in the small intestine. And I know it doesn't sound that exciting, but decoding how your digestive system works and what you need to do to fix it. Because the number one reason we see patients is pain. We're chiropractors. Number two reason we see patients are digestive problems. So don't go anywhere. We're going to come on the air in about 2 minutes.
In the WSB 24-hour traffic center, still seeing a bit of delay left over on I-20 eastbound thanks to that earlier crash at Lowry Boulevard, but mostly towards the Holmes Drive area. Travel advisory still a
Somebody sent me something on Facebook saying that fruit is, it was last week we talked about fruit and how bad it is. Not that it's bad, but you can't do much of it, it's too much sugar. And then somebody sent me an article about fruit, and it's good. And I read the article, and it is good, but you just can't do too much of it. And then somebody just posted back to it saying, baloney, all that sugar and fruit can't be good. And so it's interesting how people get in arguments on the internet. I'm just amazed at that.
My favorite part of Brent and I have an idea for something kind of exactly what you were just talking about that I think you're really going to like, but we're not going to bring it up until...
Okay, do we have any specials today? We're going to run any specials today?
We are. Special will not be available until... Well, halfway through the show, I'll create the...
code? Okay. And remind me, I'll announce it to the listeners too, because we didn't announce it last time.
Yes, Digestive Health Restore.
Yes.
Here
we go.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Listen to Dr. Joe. The 5 most dangerous words in the English language are, maybe it will go away, stop suffering, and start getting well. Dr. Joe Esposito is on WSB.
Hey folks, Dr. Joe here. So glad we could spend a little time together as always. And today, we're going to teach you how to restore your digestive health. How many people have digestive problems? Raise your hands. 85% of you should have raised your hands. If not, you're lying, because I've been in practice for a long time now, and I know that you people have digestive problems, because I have them and everybody's got them. It's not first date conversation, is it? Hi, I'm Joe, nice to meet you. A little gassy today, you know? It's not something you talk about, but people have digestive issues. Gas, bloating, diarrhea, acid reflux, constipation. Some people are afraid to use a public bathroom. They get this fear. And so these are big issues that we really have to talk about. It's not something we can just keep quiet, because your health is so important. And your digestive health is directly linked to every part of your health, your mental health, your physical health. And if you've listened to the shows before, you know I always say there's 3 things you have to have: a normally functioning nervous system, normally functioning digestive system, and good nutrition. So we're going to go a little bit more in depth than usual, in fact, a lot more in depth than usual, to discuss how you can restore normal function. But in order to fix something, you have to know how it works. And that's what we talk about today. So going to explore a little bit as to how the stomach works first, because that's how it all kind of starts. And you say you have a stomach ache. Anybody have a stomach ache? Raise your hands, right? You say, well, I got a stomach ache. Okay, you're holding down here. Your stomach is up here. Your stomach is right below your ribs on the left-hand side. Most people hold there like above their belly button saying they have a stomach ache. It's really an intestine ache if you have that. Stomach ache is up top. So if you have burning, heartburn, acid reflux, pain underneath the left side of the ribs, that's truly a stomach ache. Now there could be things like ulcers that can occur. We're going to talk about ulcers today and what they really are and why they occur. So a couple of things that can actually go wrong with your stomach. Ulcers, peptic ulcers, acid reflux. How many people have acid reflux? Raise your hands. Heartburn, burping, gas, chronic cough, sinus problems. Those are all signs that the stomach is pushing up against the diaphragm. Acid can be coming up into the esophagus, and that can cause the burning, the aching, the chronic cough, all the way up to the sinus issues. But that's just a symptom. What else happens? Well, if you have these problems, you may not be absorbing your minerals properly. You have to have a certain amount of stomach acid to digest your minerals. B12 absorption. Right as your body starts releasing stomach acids, it starts releasing something called intrinsic factor. And intrinsic factor binds to your B vitamins, your B12, and protects it essentially from the bacteria in your small intestine from eating it. And then it travels down into your large intestine, and so it's got to protect that B12 from being eaten by the bacteria in your colon, and that's what intrinsic factor does. If you don't have enough intrinsic factor, the B12 passes into your small intestine and it doesn't get absorbed. So if you have digestive issues or you're taking medication for acid reflux, how many people do that? Raise your hands. A lot of you. You're not going to be able to absorb your B12 properly. We're going to talk about that a little more in depth. And then something called incomplete digestion. Food is passing from the stomach into the small intestine partially digested, and that leads to allergic reactions and leaky gut syndrome and sinus problems. And then you start taking antihistamines and you kind of get caught in a cycle. And that's really bad. And then the way I finally realized that how my stomach was getting fixed is I was never full. I would eat and eat and eat and eat. My stomach would hurt. Literally my stomach, not my small intestine. My stomach would hurt. I had so much stuff in there. And I still didn't feel full. Because there's a hormone that's produced in your stomach called leptin. We're going to talk about that too. So let's talk about ulcers first. And folks, if you have any questions, I'll open up the lines. The number is 844-44-Dr.Joe, 844-44-DRJOE. And if you have any questions, we'll put you on low. Phones are ringing already. Holy cow, you guys are quick. All right, 844-44-Dr.Joe. Let's get into the meat, so to speak, of how your digestive system works. Peptic ulcers, a lot of people don't understand what that is. A lot of people think that they have too much stomach acid, and that's not true. Or research relatively recently realized that a lot of stomach acids are caused by something called H. pylori. H. pylori is a bacteria. This was breakthrough when this stuff came out, when the scientists finally realized this, just a few decades ago, that ulcers are caused by bacteria. And so the medical profession, and rightfully thinking, put people on antibiotics to kill off the bacteria, and it helped. The problem is it didn't just kill off the H. pylori, it killed off the good bacteria in your small intestine, and that started affecting the immune system, your absorption capabilities. One problem fixed, more problems created. So it's not too much acid. And in fact, ironically, it's usually too little acid that causes acid reflux, the peptic ulcers. So what peptic ulcer is, it's any ulceration of the acid-exposed area of your small intestine, your duodenum, or your stomach. So where the acid is being exposed. Stomach acid itself is not the problem. After strong stomach acid is a normal part of digestion. In fact, if I were to cut your stomach open right now and pour the contents out onto the carpet, it would burn a hole in the carpet. That's how strong your stomach acid is. And so you need to have strong stomach acid. That's really important. So the key word there is the acid-exposed parts of your stomach, because if you have some reason the bacteria, the H. pylori, set up shop underneath the lining of your stomach and start to multiply, they can tear little holes in the mucosal lining, and then the acid can get into that little tear, and that causes the ulcer to form. So if you have enough stomach acid, it should be able to kill off the bacteria so that they can't set up shop. When you start having low stomach acid, that's a problem. We'll talk about this a little later too. As you get older, all of us, your stomach acid and your digestive capabilities start to drop. And this is why so many elderly people have nutrient deficiencies. They may not be eating the right food, but even if they are eating the right food, they may not be able to absorb the food. That's why I am such a huge fan of supplements. You know, I have Dr. Joe's Super Greens and Dr. Joe's Essential Source. That's the minimum amount of nutrients you should take every day. Right foods, the body will start producing the right digestive enzymes, the right amount of acids, and you'll do a lot better. So folks, going to have to go to break pretty soon. If you have a healthcare question, give me a call, 844-44-Dr.Joe. My website is drjoe.com. So if you want more information about the supplements, you want to order the supplements. Oh, by the way, if you come to my offices, you save shipping, and we have, it's buy 3, get 1 free, actually, in my offices. Only if you come into the office. And the offices are in Marietta, Duluth, and Stockbridge in the Marietta area, and in the Atlanta area. So we'd love to see you as a patient. We're a team of chiropractors. We work on chiropractic and nutrition and digestion. So Marietta, Duluth, and Stockbridge, drjoe.com. Folks, got to go to break. Don't go anywhere. We're going to be right back.
You're like most people. You have neck pain, back pain, shoulder pain, numbness, tingling, headaches. Maybe it's time to stop suffering and it's time to take action. If you're sick and tired of being sick and tired, why don't you come see me and my team of doctors, and let's see if you have a problem that we can help. Go to my website, drjoe.com, or call 844-44-Dr.Joe to make an appointment today, because so many of you are out there suffering needlessly, and we want to put a stop to that. Come see us at our offices in Marietta, Stockbridge, and Duluth. Make an appointment today so we can help get you well and keep you well.
Just like a rocket doesn't always take off, your
mortgage
load with the big natural guys isn't guaranteed to take off either, even after you spend hundreds on an application.
A few from Instagram.
All right, go ahead. I got to look something up while we're doing this. Go ahead.
Is it true type O positive people are more acidic than others?
Well, that's what they say. You're supposed to eat a little more meat. In my studies, I've never seen the difference. According to eating right for your blood type, the thought is that if you're type O, you should be eating more meat because you're a little more acidic. I've tested my patients, type O, type A, AB. I've never seen a difference in the acidity in their urine or the saliva. I've never tested their stomach. I don't have that capability. So I don't necessarily agree with the eating right for your blood type concept. However, I like the fact that they do say cut out the bad foods and the processed foods. So I'll partially agree with that one. Not the acidity, but the whole concept.
So we get our first ever YouTube question.
Okay.
How can I improve my smell? Very little sense of smell.
Okay. You don't have a good sense of smell.
Correct.
Okay.
My question would be, are they a smoker? So, are you a smoker? Because that can affect quite a bit.
Yes, if you're a smoker, that's you know a lot of people that have done that over the years.
No, not a smoker.
Okay.
What can be affecting his sense of smell?
Could be it could be a pinched nerve. My father, for example, fell off a ladder a few months before I was born, landed on his butt and then fell backwards, broke his back, fractured his skull, and went deaf immediately. And he also lost his sense of smell. So his was a neurological issue. When he busted his head open, we assume the skull bones moved and pinched the olfactory nerve, the nerve that went into his sinuses. So chiropractic care would be the first thing I would look at there. And then I would look too if you do have acid reflux, because the acid could be coming up all the way into your sinuses. And then I would check to see if you're breaking down food properly. Do you have any allergic reactions? Is there a sinus reaction? So there's a couple of things we'd have to look at there. It really isn't a supplement issue necessarily. It may be a physical issue. You can try Dr. Joe's nitric oxide to increase circulation, but I have a feeling it's more physical. So, all right, go ahead.
Almost every day at 5 a.m., awaken with stomach pain and churning.
Okay.
Though upon drinking some water, you can hear the churning and then pain dissipates. Cannot figure out why this occurs and confirmed no ulcer.
Okay, so it sounds like what we're going to be talking about today. It sounds like the stomach is pushed up against the diaphragm.
Yeah.
And it depends around 5 o'clock. Do you sit all day? Do you have a big lunch? Do you have a weird lunch? Do you eat a lot of wheat or dairy or corn? That could be causing an inflammatory reaction. It finally shows up right around 5 o'clock. So the timing is the key there, but I don't know what's causing it. So the first thing I would do is see if the stomach is up against the diaphragm, pull it back down, and once it starts to churn, it kind of moves the stomach around a little bit and takes the pressure off it. So that would be my first thought on that. So if you're in the Atlanta area, come see us and we'll check the stomach out for you.
I have a few Instagram questions.
Okay.
We have one listener that had gastric bypass surgery.
Yes.
And he wants to know if Dr. Joe supplements are immediate release.
Yeah, they're powders. Yeah, so they are immediate release, and people with gastric bypass, I believe, if I was the grand poobah of the universe, it would be the law that everybody had to do powdered supplements because they're so easy to absorb. So the answer is absolutely positively yes, especially for gastric bypass patients.
And then, what are your thoughts on separating solids and liquids, like when eating?
Oh, we're going to talk. You're jumping ahead of me here. We're going to cover that. The answer is yes.
Another question. Yes.
Yes. The answer is yes. You shouldn't drink a lot while you're eating. If you're going to drink about 10 or 15 minutes beforehand, which I do recommend you do. Okay. I do recommend you drink 10 or 15 minutes beforehand because that you get water in your body, and that's going to help you feel more full. So, okay.
Okay.
To you. Start today with something completely in your control. Your health. Dr. Joe Esposito is on.
Hey folks, Dr. Joe here. So glad you're here today with me. And if you're just joining us, welcome. If you stayed with us, thanks for staying with us. We're talking today about restoring digestive health. And so many times, if you listen to my shows in the past, I talk about massaging the stomach or adjusting the stomach away from the diaphragm. But I never really get into the details of how the body works, the anatomy and the physiology of anything, the digestive health today. Anatomy is where things are. Physiology is how they work. So this is my heart over here, my left side of my body. The physiology is how my heart works, how it pumps, and mitochondria, how it makes the muscles contract. That's more the physiology aspects of it. And so we're talking about that today. And we started talking about peptic ulcers. The bottom line, peptic ulcers occur when the mucus lining of the stomach or the duodenum, the upper part of the small intestine, somehow is being irritated by the acid that's there. We all have acid in our stomach. The higher the acid to a point is good. And as we get older, we stop producing as much acid, and that's one of the reasons we're not as healthy as we are, and that's called the aging process. So it's really important we get that working properly. So the H. pylori, everybody thinks is the culprit, which it is. But the problem is when the H. pylori sets up shop. We probably have it in our bodies. Most of us, if not all of us, have this bacteria in our bodies. And just like viruses, we have viruses. I have enough viruses in my throat right now to probably wipe out the whole country if everyone's immune system suddenly shut down. But everybody's immune system isn't shut down. And that's why we're not sick all the time. That's why it's really important that you understand that you got to keep the body healthy. So the lower the acid in the stomach, the H. pylori can set up shop. So the organism, it thrives underneath the mucosal lining, and that's when it can tear little holes in the stomach or the duodenum. And I know this is getting exciting, isn't it? Stomach acid is not the cause. I want to get that across to you. And the problem is this: when people have acid or burning, they start to take things like antacids, which help neutralize the acid, or they take proton pump inhibitors. And proton pump inhibitors stop your body from producing the acid, and they can shut down about 99% of your stomach acid. Problem solved. But what happens is you need stomach acid to digest, specifically your proteins. And so your body measures what's called the pH in your stomach. pH is how much acid there is in your body. The lower the number, and this always confused me when I went to school, the lower the number, the higher the acid. The higher the number, the lower the acid. But I didn't like that. Whoever did that messed me up. So if you have a low acid, low pH, that's very good. As your pH gets higher and higher, it sends a feedback loop up to your brain. The brain sends a message back to your stomach and says, produce more acid. So if you're neutralizing the acid or shutting down with proton pump inhibitors, there's going to be a feedback loop that says you need to make more acid. And that's where the problems come in. Because then you make more acid and you have more burning, and what do? You take more medication. And so you get caught in a trap there. All right, let's start taking some callers. If you have a question, folks, 844-44-Dr. Joe, 844-44-DRJOE. Michael, how can we make your day better? Yes. Okay, so what happens is with the riboside or the ribose, D-ribose is another form of it. It works with the mitochondria. The mitochondria are the part of the cells that produce energy. And so they're the things when you're young, you're producing prostaglandins, which control inflammation, and they produce DHEA, which becomes sex hormones. And not just the act of sex. Testosterone, you think, oh, that's a sex hormone, or muscle building hormone. But your heart's a muscle, your colon is a muscle, your blood vessels are muscles. And so as your testosterone drops, your body, the muscles are going to become weaker. And so that's why it's important to keep our testosterone levels up. Now, if you take it from an outside source, I know one of my friends, she took a testosterone and she was like, oh my gosh, I feel like a 14-year-old boy here, and she's a 60-year-old woman. But that's not normal either. You need to get it higher. I think hers was too high, actually. So you can do that by taking care of your adrenal glands, because the adrenal glands produce all these things, and that's why I take adrenal support. And if I eat something that's all cooked, if I eat an all-cooked meal, I will then take digestive enzymes. And we're going to talk about digestive enzymes later on when it comes to ulcers, because the digestive enzymes will help break down the food more efficiently and pass it out of your stomach faster, so that the area that's irritated, like the ulcer, is not going to be exposed to acid for that long a time. So digestive enzymes don't change the amount of acid in your stomach, they just speed up the process and pass it on, so that the ulcers aren't being exposed to the acids, so that they can heal. And we have one called Dr. Joe's Digestive Enzymes, and they're pretty awesome, and you can try that as well. So anytime I eat something cooked, I'll take Dr. Joe's Digestive Enzymes to break down the food more efficiently. And all the supplements, by the way, are on my website, drjoe.com. Very simple, drjoe.com. Real, can't beat that. Now, if you want to order supplements, go to the website. If you have any If you want to make an appointment to come see us, we have offices in the Atlanta area, Marietta, Duluth, and Stockbridge. We'd love to have you come see us. And if you want to get the supplements, come by the office and pick them up. Save the shipping. I have no desire to pay the post office if I don't have to. Folks, got to go to break. If you have a healthcare question, 844-44-Dr. Joe. Again, the website's there 24 hours a day. Lots of good information on the website. We have a blog. A lot of my articles are there. Well over 1,000 hours of podcast, audio, and video. Hey, do me a favor. Follow me on Facebook. Follow me on Instagram, because we stream a lot of these shows live, and you can watch us. Got to go to break, folks. DrJoeEsposito.com. Don't go anywhere. We're going to be right back.
Did you know that over 90% of male enhancement pills are virtually the same thing that's redone over and over again?
No.
Why settle for the same old product when you can get something that really works? Men, you try Dr.Joe, the explosive male enhancement formula that will unlock your performance in the bedroom to a level you could only dream of. Try to imagine Viagra on steroids.
Okay,
There we go.
have a breast cancer survivor, and they've been told that their vitamin D level is low. Is that a result of breast cancer?
Other way around.
Breast cancer is a result of the vitamin D level.
Oftentimes, yeah. And that's one of the things we're finding now with vitamin D is, get my super greens in there for today, my second dose. The vitamin D levels is now linked to everything from immune system to bone function to cancer. And so it's extremely important that everyone keep their vitamin D levels where it's supposed to be. I have a product, I don't have a bottle with me, Dr. Joe's Vitamin D, and it's a vitamin D3. Because here's my concern. A lot of times, doctors will prescribe vitamin D, and it's vitamin D2. Vitamin D2 is a synthetic version of vitamin D3. It has to be converted into vitamin D3. And so that's a big concern of mine. I'd rather you take the vitamin D3, and ours, vitamin D3 also has K2 in it, because K2 is part of the bone building structure as well. So you need K3, vitamin K2 and vitamin D3 to build a normal bone. So the answer is, yeah, as a cancer survivor and everyone else, you need to get that vitamin D. I take 5 drops a day, and that's 5,000 international units. So I take 5,000 a day. I think you should too. And especially with that. And then take it for a while. Next time you get your blood work, check it and see where it is then. Hopefully it'll bounce back up again. So yeah, vitamin D, and it's on the website, drjoe.com. Next.
Okay, so you mentioned the drop in stomach acid with age. Do you know of any ways to maintain or increase the production?
We're gonna get there. We're gonna get there.
They've got all the questions.
Because your Instagram, no supplements help my gut, acid reflux all the time. Okay, good. All right, so shut off. There you go, Jennifer there. I'll give you a preview. Digestive enzymes, Dr. Joe's Digestive Enzymes, absolutely positively. The other thing you can do is apple cider vinegar, raw organic apple cider vinegar, about 2 tablespoons a day, and you can mix it with honey, you can mix it with stevia, you can mix it in water. I use it as part of my salad dressing every day because I don't like the flavor, it's a little strong, but that will actually stimulate the digestive enzymes. And If you want that and that and that and that, and they put anything you wanted in there. And then if you wanted meat or tofu or something, there was an upcharge. You wanted soup, there was an upcharge. And it was really good. I have to say, for $8, you got a bowl that was huge. And I enjoyed that. And then when I got home before the show, I had some split pea soup that I had in my refrigerator that I had made, you know, homemade and organic. Had a little bit of that. And then I had some shredded cabbage that I had in my refrigerator. And that was all I ate so far. And then, of course, super greens and essential sauce earlier, and now I'm having it again. So a lot going on today. So when I have a...
From having an active immune system, what are a few ways to boost your immune system?
Oh, that's a great one. I'm sure we're doing lots of those as winter sets in.
Yes.
Dr. Joe's Wellness Booster is an herbal supplement that we have. It's a dropper bottle, and it's Echinacea, Paldiarco, olive leaf extract, and suma root. And I know you can buy those separately. It's extremely expensive. We mix it together for you. It's a whole lot cheaper. And I take, in the winter, I take at least 2 dropperfuls of that every day. Yes.
Coverage of traffic and weather.
phone?
Jill Nelson is in the
My phone.
WSB 24-hour traffic center. New crash on I-20 eastbound before exit 46 Riverside Parkway.
Move the health book to left closer. Okay, I'm getting a text here. Okay, there you go. Like your jean look, good color combination. Okay. There we go. Okay, got it. So the immune system, yeah. So Echinacea, Paldiarco, olive leaf extract, but the key is going to be this. When it comes to your immune system, you got to cut out the sugar. And ironically, the time we eat the most sugar is in the winter, and in the winter is when we don't need the sugar. Our immune system is stronger in the summer. So vitamin D, 5,000 units a day, Echinacea, Paldiarco, olive leaf extract, and suma root. If I feel myself getting sick, I take something called seasonal tonic, and that's ginger, horseradish, cayenne pepper, onion, and garlic in an apple cider vinegar base, and that'll help wipe out the infection. And then you got to cut out the sugar. That's going to be the key. But the vitamin D is going to be one of the big ones that everybody forgets about. Coming back.
Depend on it.
If you're like most people, you have neck pain, back pain, shoulder pain, numbness, tingling, headaches. Maybe it's time to stop suffering, and it's time to take action. If you're sick of being sick and tired, why don't you come see me and my team of doctors, and let's see if you have a problem that we can help. Go to my website, drjoe.com, or call 844-44-DR-JOE to make an appointment today, because so many of you are out there suffering needlessly, and we want to put a stop to that. Come see us at our offices in Marietta, Stockbridge, and Duluth. Make an appointment today so we can help get you well and keep you well.
Hey folks, Dr. Joe here. So glad you could spend a little time with us today. We're talking about restoring your digestive health. Because it's funny, because a lot of times we'll stream our shows on Facebook and Instagram, and then you guys call in, and then people send me questions throughout the week. And whenever we do a show on digestive health, the phones light up, the messages light up, and everybody wants to know, what about this, what about this, what about this? And you have to fix the stomach, and you have to fix the digestive system. It's really, really important to do that, because the digestive system controls everything. Nothing happens unless the digestive system is breaking down food so you can absorb nutrients to go to the brain, and then the brain tells the stomach how to work. Those two work together. And in fact, when mommy and daddy got romantic, yeah, well, that's what our next topic is going to be acid reflux. And you have a sheet of muscle called the diaphragm, and you have a hole in the diaphragm. It's called the lower esophageal sphincter. And the food falls into that hole. It opens up. That food drops in. You close it. You digest food, and you pass it on. If you have GERD, gastroesophageal reflux disease, the stomach is pushing up through the hole in the diaphragm, and then acid is coming up. So in this case, sounds like you have this, the problem is physical, not chemical. And they're trying to treat it chemically. It's like changing the oil in your car, which is good, but you got to change the spark plugs too. And so physically, we would take the stomach and massage it and pull it down away from the diaphragm. And in most cases, and I can't make promises, of course, but in most cases, people want to name their kids after you when you fix their digestive problems. So, yeah. Are you in the Atlanta area? Where are you? Oh, perfect. Oh. There you go. We have an office in Stockbridge, actually. So why don't you do this? Call that. Good. Yeah. Perfect. We'll look forward to having you come in then, Yolanda. Thanks so much. All right. Thanks a lot. Bye. Yeah, and folks, if you want to make an appointment, the number 844-44-DR-JOE rings through to my offices when I'm not on the air. And as a team of chiropractors, we always work on the physical aspects. Now, if there is something medically wrong, of course, we we co-manage cases with medical doctors and hospitals all the time, nonstop, all day. And so many medical professionals send us their patients because they get stumped just like you do. Oh, gosh, we tried everything. We put them on some drugs and it didn't work, and maybe it's a physical problem. Joe, have your team of doctors look at them for me. Yes, sir. And then we send them back if we need to, or we say, hey, they're better, and we'll put them on, tell them to come back and see if they need to in the future. So we're fine co-managing cases with our fellow doctors, and we have, I think, a doctor that I can't imagine any doctors we don't have somebody we can refer to. So arm pain, neck pain, orthopedists, neurologists, neurosurgeons, psychiatrists, psychologists, MRI companies, we work real closely with them. So let's continue on with this acid reflux concept. If you have a question, give us a call, 844-44-Dr.Joe, see if we can get you on the air. Acid reflux, also known as gastroesophageal reflux disease, or GERD. And if you go to my website, drjoe.com, under Dr. Joe's blog, those are my articles that I wrote. The first article, and the reason I moved it, I had my web guy move it right to the top because it's the most popular article by far. This number 2 most popular article we have is about attention deficit disorder. It's not a drug deficiency. And so many times we treat ADD as a drug deficiency and we just give you more drugs. Now, again, I'm not against drugs. Please understand that. But if there's a way to fix it without the drugs, that's what we try to do in our office. We try to get to the cause of the problem and not just treat the symptom. Because if we're just treating the symptom, we usually don't ever get results. Getting to the cause, then hopefully we can get you off those medications. And all the doctors we work with have the same thought. We'd love to get our patients off the medication, but we may need it short term. My concern is if there's no plan beyond what do I do now? And sometimes you need it forever. There are perpetual care patients that need medication forever, and some people need surgery. But if we can fix it without the drugs and the surgery, that's the approach we want to take. So what happens is the acid in the stomach can reflux up into the esophagus, irritate the esophagus, and the new buzz I'm seeing a lot of, eosinophilic esophagitis, where you start getting white blood cells. You like that one? Okay, my staff is smiling at me. That was a good one, huh? Eosinophilic esophagitis, the acid comes up into the esophagus and it can cause an irritation, so the body sends in eosinophils, or a certain type of white blood cells, to kind of attack the acid attacking the body. And so we have to figure out, why is the acid coming up? Is there something wrong with the lower esophageal sphincter, that hole? Do we need to pull the stomach away from the diaphragm? Do we need to get somebody on a more alkaline diet? Maybe they're eating too much acid foods, things like alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. That's your whole diet, isn't it? My God, Dr. Joe, that's everything I ever ate my whole life. Yeah, that's a very acidic diet. And so that'll throw off your acid too, and we're going to talk about that a little bit later if we have time, on how when you put acid in the body has to use calcium and other minerals to neutralize the acid. And so patients come in all the time and they have acid reflux, and then they have osteoporosis, and they can't figure out the correlation, and I clearly give them that correlation. Let's fix the digestive system, get you on an alkaline diet so your body can absorb the calcium and stop using the calcium. That's what we're shooting for. So we've got a lot to talk about when it comes to acid reflux and gastroesophageal reflux disease. We're going to talk about that in a second. Talk about how your stomach digests food. What happens? When does digestion start? I want you to think about that question. When does digestion start? You can be surprised when I tell you that answer. If you have a healthcare question, give us a call, 844-44-Dr.Joe, my website, drjoe.com. You can order supplements there. You can order books. You can send me questions. You could read my blog. You can listen to well over 1,000 hours of podcasts there. If you have a podcast service, we call it For the Health of It, if you want to listen on your podcast service. We want to naturally get you well and keep you well. Folks, the number here at the studio, 844-44-Dr.Joe. Don't go anywhere. We're going to be right back.
Does this sound like you? Neck pain, back pain, shoulder pain, headaches? Chances are you'd benefit from chiropractic care. Most people benefit from chiropractic care because chiropractic care tries to get to the cause of your problems and not just cover up the symptoms. If you're ready to get well, I want you to go to my website, drjoe.com, or call 844-44-Dr.Joe and make an appointment for you, your friends, and your family today. We have offices in Marietta, Duluth, and Stockbridge. Make an appointment today so we can help get you well and keep you well.
Every handshake
can lead to something different.
Next.
I was smiling because not even a minute before you mentioned it, somebody just posted on Facebook asking about EOE.
Eosinophilic esophagitis. Isn't that freaky?
I had no idea what it was, and then you said it right in that second.
That's like cosmic freaky dude stuff. So now you know about eosinophilic esophagitis. Come see us. Hopefully we can fix it. There. Cross that question off the list. Good.
Okay, so we have a question about the digestive enzymes.
Yes.
Should they take that at meals or once a day?
It depends what your goal is. Now, today we're talking about restoring digestive health, so you take it with a meal. Now, it doesn't have to be like the minute you put food in your mouth, take an enzyme, as long as it's around that time, okay? Now, that being said, if you take digestive enzymes between meals, we'll probably cover this in a future show when we talk about the immune system. If you take between meals, the enzymes get absorbed into your blood system and can help fight off viruses, germs, and bacteria. So that's how you do it. Yeah.
Okay, and then we have another question. So this listener, they have a coworker that had stomach surgery. Then they tore the stitches, they went septic, developed jaundice, and now they've been retaining fluid and being in and out of the hospital. Do you have any suggestions?
I probably need more information on that one, but this is what, based on what you've told me, I would say Super Green is an essential source, easy to absorb. And that's the key here. You want to take the stress off the digestive system so it can heal. So Super Green is an essential source 2 or 3 times a day actually is fine. A scoop of each 2 or 3 times a day. Absolutely no animal products. Meat, dairy, butter, cheese, yogurt, eggs, ice cream. The dairy, and yes, that's so hard to digest. So no animal products there. If you could do raw foods, great. If you can't do raw foods, cooked vegetables will be fine at this point because the body's got to heal. And if they're retaining fluid, it could be a circulatory issue. So you could try, actually massage might be good for you here, where you can massage and move the fluid around, or just move. And I know they had, that's me, I was going to say, it sounds like me, it is me, doing a commercial for a roofing company. If they have a rebounder, and again, if they have surgery, I don't know if they can do this or not, but very gently just bounce them up and down on a rebounder, and that'll help get the lymphatic system flushing out the fluids. But nutrition is going to be a key, and then chiropractic care to open up the nerve supply to the organs is going to be vital as well. What else we got? What do you have? What do you have?
Does digestion start in the mouth with chewing and saliva?
We're coming back to that.
This person's got some good questions.
Okay.
It's all the same one with all the...
The answer is it's before that. How can it be before food gets in your mouth? So, they have other good questions?
Stay tuned.
Stay tuned for that one. When does digestion start? Ooh.
Okay, and then I have another question from the same person. So the second brain that you talked about earlier, is that called the solar plexus?
No. Well, if you're looking at chakras, then that's on a more esoteric level. The second brain is just the digestive system is the second brain compared to the first brain. But the solar plexus is right in here, and that's excuse me, one of the chakras, and that's a whole other lecture on Indian medicine and Ayurveda, and we're not gonna do that one today. So, but good question. Somebody's hip and cool.
I just wanted to say to Facebook, YouTube, and Twitch, sorry for all the problems. We have been using this little guy as a hotspot, and it is not picking up the best signal in this room, so we're going to find alternative methods. But since we have switched to a separate hotspot, and we are running just fine, so no more delays, no more
we're back up on that one?
service.
Okay. See how good these guys are? I didn't even know there was a problem. That's how good. Those are professionals right there, folks. Oh,
30 seconds.
Thank you. And Ahmad, he's awesome.
Gridlock alert on the south side, 285 eastbound outer loop before exit 48 Flat Shoals. At least two right lanes are blocked there, occasionally 3 thanks to a downed helicopter went down in the woods right next to the interstate there, and so they've shut down a couple of lanes to do the investigation. So stay to the left or avoid this altogether. Use Clifton Church Road as a possible alternate in that area. Travel advisory: road work on the north side, 75 in both directions between Canton Road and Delk Road. That's got 2 right lanes shut down southbound, 3 left lanes shut down northbound. Use Highway 41 as your alternate. Jill Nelson, WSB.
If brains were looks, he would be the Brad Pitt of radio. That's why you listen to Dr. Joe Esposito on WSB.
Hey folks, I am here, Dr. Joe, and I'm so glad you're there. And I assume I don't know your names, but you call in with questions, and I'll know your names at 844-44-Dr. So if you have a question, give us a call, 844-44-Dr. That number, as you know if you're a regular listener, rings through to my offices when I'm not on the air. So we want to help you get well and stay well. And follow me on Facebook, follow me on Instagram. A lot of times we live stream the shows, and then you can see my pretty face. And you could even watch it and simulcast it on radio if you want to. Then you really get cool, and that's how they do with sports sometimes. So, also, do me a favor, go to my website, drjoe.com, and send me your email address. And the reason I ask this is we give out, many times we'll have giveaways. We'll have supplement sales, we'll have tickets to lectures. Sometimes radio stations will give me tickets to events. We have extra ones, and we'll send it out as an email. And so if we have your email address, you're part of the cool kids, and we're going to send you out information that you're not going to get anywhere else, including Facebook and Instagram and everywhere else. And I promise you we'll never give out your email address to anyone ever, ever, ever. And we send out a newsletter. We send out a newsletter on Mondays now. So if you want to get cool, we send you recipes sometimes, tips on how to get well, things you're not going to get on radio shows. So send us your email address at drjoe.com, and then you can be one of the cool kids. So somebody sent in a question, and I teased. That's called a tease, by the way. When you come up to a break and say what we're talking about next, when does digestion start? And so somebody said, does it start when you put food in your mouth? Does it start in your mouth? And the answer is it starts before that. And it's called the cephalic phase. And 30% of your stomach acid is released by anticipation of eating or smelling food. So 30% of your digestive enzymes happen before the food even gets into your body. This is why it's important for digestion to have nice presentation. Or smells. How many of you have a reaction to smells? Because the olfactory nerve is what's called the cranial nerve. It goes directly into your brain. And it's such an amazing link to your brain, because how many times have you smelled something and it brought you a flashback? Your grandmother's house, some girl you used to date, high school locker room. The smell can trigger memories in your brain. So smelling the food is important as well, because that's why that helps the digestive system. And when you have a stuffy nose and you're sick and you can't breathe properly, what happens? You can't taste your food either, because you're not smelling it. So even though you may not be aware that you're smelling it, you are. And so that's the cephalic phase. And so it's governed by something called the vagus nerve. And I'm a guest on a regular guest on a show. A friend of mine, Eric von Hessler, does a show. And for some reason, his crew just loves the word vagus nerve, and they just think it's hysterical. And they're like little kids. You say vagus nerve, like, yay! So it's a lot of fun, the vagus nerve, but it's really an important nerve. It starts in what's called the medulla oblongata. Love that, part of your brain. And it runs through your neck and connects to virtually every organ in your body except your adrenal glands. Kind of interesting why it's not technically adrenal glands. I don't know. I got to talk to the guy who put this all together and find out why that is. And it's such an important role in digestion. So once things are sensed, it goes into the brain, to the medulla oblongata, sends a message down the vagus nerve. The vagus nerve sends messages to your digestive organs, like your stomach and your pancreas, and that's when digestion starts. So one thing we can do to restore digestive health is, before you have a meal, look at it. Imagine what it's going to taste like. Here's a test for you. Okay, play along with me. Ready? Imagine this big, juicy lemon, probably the size, I don't know, of a big orange or a grapefruit. Really, really big lemon. And you smell a lemon. You know how lemons smell, right? I want you to take that lemon and you squeeze it. It's a little soft. Going through this in your mind? Slice the lemon in half in your mind. Got it? Now cut it in quarters. Still with me? Now imagine this lemon being the most tart lemon you've ever had in your mouth, ever. Imagination, I want you to take that slice of lemon and put it in your mouth. What just happened? You started to salivate. Everybody here in the studio is like wiping their mouth. You start to salivate. So that's the cephalic phase of digestion. Your mouth starts producing saliva. Saliva has something in it called salivary amylase. And salivary amylase helps break down carbohydrates. Your stomach acids break down proteins. Then the food passes into your small intestine from your stomach. Hopefully it's digested properly. That's what we're talking about here. If the stomach isn't doing its job, it sends the food partially digested into your small intestine, and then your pancreas kicks in protease, amylase, and lipase to break down proteins, carbs, and fats. And then your gallbladder kicks in and releases some bile to break down the fats. And I've talked about this in the past. So if the cephalic phase isn't kicked in, you may not be digesting your food up to 30%. Because you're not getting the vagus nerve to kick in and make it start to happen. So next time you have a meal, take 2 seconds. Look at the meal. Smell the meal. Think about what it's going to taste like, and that's going to help restore normal digestive function. Pretty cool. A lot more to talk about. I'll talk about the second phase called the gastric phase, but let's start taking some callers. If you have a question, 844-44 Dr. Joe is the number here at the studio. Jordan, how can we make your day better? Uh-huh. Yep. Mm-hmm. Yep. Yep. Uh-huh. Sure. Yep. Sure, he's absolutely right. You have the Heidelberg, you've had it for years. The acid is coming up into the lungs. It's irritating the throat, and that causes chronic cough. And I'd probably say in our offices we see about 3, maybe 4 patients a week with exactly what you just described. So if you have that chronic cough, sinus problems, it can go all the way up into the sinuses. And so we need to take the stomach, if you have this condition, pull it down away from the diaphragm, try to get that lower esophageal sphincter to close, and then the stomach, the acid will stay in the stomach, break down the food, and then go into your small intestine, going down instead of up. And so can it affect asthma? Absolutely, because it can irritate your bronchial tubes, and you get inflammation, and it's hard to breathe. So with asthmatics, as a chiropractor, I always check the lower part of the neck. Those are the nerves that control the lungs, the bronchioles. Then we check the acid reflux, and in most cases, we get very good results with asthmatics. So the answer is yes, you're absolutely right. Sure. Uh-huh. Oh, yeah. Yeah, absolutely. Because when you're a kid, the muscles are really weak. And how many kids burp up all the time? And kids throw up constantly. Well, that's because that sphincter, the lower esophageal sphincter, isn't closing, allowing food to stay into the stomach. And as you get older, your muscles get stronger, including your diaphragm and your sphincters, and you're able to hold the food down better. But if there has been enough damage to that sphincter, it just never got tight like it should, yeah, it could be something that's been going on forever. So, yeah, come see us, Jordan. We'll get that fixed. Great. Thanks so much. Right. About 3 hours, 3 or 4 hours. Yeah, try to stay away from food for 3 hours before you got to run to a break. Folks, if you have a question, 844-44 Dr. Joe, my website. If you want to get the supplements, send me questions, listen to podcasts, drjoe.com. We want to help you get well. Hey, don't go anywhere. Tell your friends about the show. I'll be right back.
No one delivers an update on the 5 p.m. news like WSB at the end of
Okay.
All right.
Okay.
Now that I'm free.
You're Facebooking?
Okay, so we'll get the awkward one out of the way. What to do about a flat stool?
Flat stool.
What does it mean and what to do about it?
I don't know what it means to have a flat stool. If it's not round, I'm assuming it's flat. You could have sphincter, if I'm picturing flat. It could be that the sphincters, your rectum, you have 2 sphincters. You have an external and internal in your body. And I guess that's just backup plans. Nature usually has a backup plan for you. So if one of them fails, you don't just leak constantly. And so if that's the case, you might have a tight sphincter, and that's usually the nerves in the coccyx area. That's the nerve supplying the low back and the tailbone that controls the sphincter. So if that's the case and it's difficult to pass the stool, I would check the nerve supply to the bowel, to the sphincter, and I would also get on Dr. Joe's intestinal cleanser. That's on the website, drjoe.com. And the intestinal cleanser is very good to soften the stools and then make it easier to pass through those tight sphincters. But if it's a tight sphincter, you got to check the nerve to the sphincter. So.
Okay.
I think that was the most times I ever said sphincter in one sentence.
All right, so this person has had 4 stomach surgeries and wants to know what they can do about scar tissue on their intestines.
That's such a tough one, man. You can go to a massage therapist who knows how to massage the digestive area. You got to be careful, though, because you got blood vessels and a lot of stuff going on in there. If you need one, I can refer you to one. She's great, my friend Jo Elise, and she's awesome. And you can get a massage there, and then also you have to make sure if you have scar tissue, you have to eat foods that are easy to absorb, like super greens, an essential source, plant-based diets, staying away from the animal products, staying away from dairy and wheat and corn because they cause inflammatory reactions. Probably get on Dr. Joe's Digestive Enzymes as well, because the digestive enzymes, in your case, I would take it probably every meal. Sometimes the enzymes can help break up that scar tissue. So physically as well as chemically, you want to address those scar tissues.
All right, and what is your ideal breakfast?
Super greens and essential source. Absolutely, there's no question there. That's my first thing in the morning. And I like to have a piece of fruit or 2 in the morning. I really enjoy that. So I'll have sometimes frozen fruit, frozen organic blueberries or strawberries or mango, fresh fruit, of course. Watermelon is great. And then usually right around 10 o'clock or so, I start to get hungry. So then I'll have a handful or 2 of nuts. And in my office, I've got a little drawer, and my staff all knows where my food stash is, so they'll go back if they're starving to break into my food stash, and they have my permission to do that, of course. And then lunch is usually a salad or something light, vegetables. And then dinner varies. It depends what I'm in the mood for dinner. It's always vegan. But the ideal breakfast would be super greens, an essential source, and maybe some fruit.
And what are your thoughts on ONOs, overnight oats?
Oh, great. Overnight oats are great. Absolutely. In fact, oats have something called beta-glucan, and as we get into cold and flu season, I'm going to talk a lot about beta-glucan. It's found in oats. It's also found in nutritional yeast. And you want to do oats and or nutritional yeast every day to get the beta-glucan, which can cut your risk of getting a cold or flu well past 50% less. And if you do get sick, 50% less severe and 50% shorter. So beta-glucan is rocking, man. That with vitamin D is just awesome for the immune system.
Okay, if we got time for one more.
We got plenty of time. We got 6 minutes, and I just dropped a caller or two, so we're good.
Perfect. Why is salt not one of your 7 deadly sins of nutrition?
Got to do promos. So hold on, folks.
Yes.
Hold that thought. That's why I'm on my producer. Let me get my promos out.
I'm going to get the promo code ready.
That's right, you got the promo code ready. Okay. Got to do these for my other radio stations around the country. So, I'm Dr. Joe Esposito. This week we're talking about restoring digestive health, the things you need to do to start absorbing your nutrients and get healthy. Dr. Joe Esposito here. This week on my show we're talking about restoring your digestive health and the things that you can do to fix problems that you may have. Hey, we're talking about restoring your digestive health and what you need to do about it this week on the Dr. Joe Esposito Show. One take. We're professionals. Okay, salt. There's good salt and there's bad salt. That's why. The good salt would be air-dried sea salt, Himalayan salt, pink salt, brown salt. Those are the good salts. So I think salt is actually a nutrient that you should add to your diet, not take it away. Just don't use the white salt, which is junk. Because what they do with white salt is they take the nutrients out, the 70 plus minerals that are found in air-dried sea salt, and then they package them and sell them to your supplements. So why not just take the air-dried sea salt? It's not very expensive, and it tastes way better than regular salt anyway. So there's that question. What do you have? What else you got?
Silent. Oh.
Puberty over there.
Silent reflux.
Yeah.
They said, is it real or not? How does it become silent? Like, how do the symptoms get hidden?
Oh, yeah. Well, you could have a little bit of acid reflux, and it's not quite showing up yet, but it's still eating away at your esophagus. Mm-hmm. So that's why in our office we test almost every patient that comes in to see if they have a problem. We use something called applied kinesiology to test it. And if you have that problem, it takes 30 seconds to test. Then we start adjusting the stomach. Even if they don't have symptoms, we test it. People may have bloating, they may have gas, they may have food getting stuck in their throat. It may not be actual GERD or gastroesophageal reflux disease, but when we test it, then we go ahead and fix it. And it's pretty common. About 85% of our patients have it, myself included. So.
Okay, and strep throat. Does it stay in your stomach and cause bloating and digestive issues?
Strep throat.
Yeah, they said that they have been told that strep throat will stay in your stomach and cause bloating and digestive issues.
Well, we all have strep in our throat. Right now I have it, you have it, Garrett has it, Ahmad has it, Justin has it, everybody's got strep in their throat. It's when the strep sets up shop. It's like the H. pylori we talked about earlier. We all have the H. pylori, most of us have the H. pylori. It's when it sets up shop and causes a problem. That's where the problem is. So if you're concerned about that, if you have strep throat, I would do Dr. Joe Seasonal Tonic, which is ginger, horseradish, cayenne pepper, onion, and garlic, because it's antibiotic, antiviral, and antifungal. And I would take that. It says take once a day. I would take a dropper full every half hour. And then it can wipe out and help knock out the bacteria and the viruses in the body. Now, again, not a medical doctor. I'm not telling you to treat the disease, but this is what I found works from an herbal standpoint.
All right. Coupon code is set.
Oh,
I won't tell you what it is yet, because...
Yeah, because you know me, I got a big mouth. I'll blab.
But we are going to do $5 off $50 or more spent with free shipping.
You love spending my money, don't you? Man. See, I don't need a wife. I got this guy here. So it's going to be $5 off any order, $50 or more, and free shipping. You're killing me here, Garrett. You're killing me. Why do I let this guy do this?
All right. scoliosis?
Yes.
So scoliosis and kyphosis.
Kyphosis. Where's our bell? We got to get it out. Somebody took the bell that they left here for us. You saw it?
Yeah.
Oh.
Aha! It's a different bell.
That's the same one.
Is it?
Yep. Okay. Scoliosis. When Garrett gets it right, we give him a bell.
Kyphosis.
Got it wrong.
Kyphosis.
Kyphosis. All right.
What kind of nutrition help do you have for scoliosis and?
That's structural. Now, the basic nutrition is going to be there. The super greens, the essential source, the B vitamins, the vitamin D. Those are the core supplements, the adrenal support. But scoliosis and kyphosis is structural. And in every scoliosis case I've ever seen, and I've been doing this for 35 years now, there's a muscle called the psoas, and the psoas muscle spasms. And I've always find that we work on the psoas, it helps, and then with chiropractic adjustments, helps straighten out a lot of that. So for that, you really got to come see us. I don't have something I can give you to do at home. This is one you got to come see us for. Oh, here we go. Hold on.
Depend on it.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Hey folks, Dr. Joe here. So glad we could spend a little time together. Good show today, actually. Yeah, well, all the shows are good, I think. I like them. We're talking about restoring digestive health. How many people have digestive issues? If you're not raising your hand, you're lying. So we got to get the body working normally. And it depends. Is it acid reflux? Is it heartburn? Do you have a peptic ulcer? You're not producing enough acid? You're getting older? Somebody sent me a question the other day, and they said, Dr. Joe, how do you know you need supplements? Well, I think all of us need supplements, but if you're 50 or older, absolutely, your digestive enzymes are dropping. You're going to need to take supplements. Postmenopausal women, of course, less than ideal eating habits. That's pretty much everyone. Chronic stress, overwork. You're not taking a daily multivitamin, because I think everyone needs that. And that's the essential source, by the way. The essential source is fruits and vegetables in powder form, prebiotics, probiotics, digestive enzymes, and a complete multivitamin. So yeah, you should be taking it. Everyone should. Including children, by the way. I get calls all the time in the office and say, how young can you give a kid essential source and super greens? Once they're on solid food, you can start adding a little bit. Now, I weigh 185 pounds. I take a scoop, and most adults or, people, teenagers will take a scoop. You might want to start with a teaspoon and add it to whatever they're eating. Their applesauce. Nice little trick that works really well is take a frozen banana, some frozen berries, whip it up in a food processor, and add the super greens and essential source to that, making your smoothie out of it. But yeah, if the kid can eat solid food, they can start taking the super greens, the essential source. Not getting enough sleep. Vegetarians. My God, I'm saying something bad about vegetarians? Yeah. Because B12 comes from bacteria eating flesh. And it's a waste product of the bacteria digesting the rotten flesh, or the dead flesh, of course not live flesh. And that B12 is produced. Now, as I'm a vegan, I've been a vegan for 32 years, I don't get B12 like a meat eater would. And so I supplement with Dr. Joe's B complex, and the super greens, the essential source. The essential source is the complete multivitamin as well. If you smoke, if you consume more than 3 alcoholic drinks a week, which is most of you, I know how you are. If you're living with an existing health concern, if you're taking medications, if you have a disease, these are all reasons to take supplements. But interesting, if you're not taking a supplement, you should be taking a supplement. That's a reason to take a supplement. Because most of us are not getting the nutrients that we need in our diet. And the soil has been depleted. We're under a lot more stress. We have artificial lighting. We sit in traffic all day. We sit in front of a computer. We're not standing as much as we used to. We're not moving around as much as we used to. And so we need these things to keep the body healthy. So as our lifestyle changes, we need to change our nutritional needs change as well. And of course, getting older is just a big issue. Our digestive enzymes drop. So it's pretty important that you do take those supplements. And at least, please, at least take Dr. Joe's Super Greens and Dr. Joe's Essential Source, the minimum amount of nutrients you should be taking every day. And Garrett, one of my producers, is telling me that we're going to give a special. We're going to give a special just for this week, right?
Oh. That's right.
Can I say it yet? Oh, there you go.
No, I can't say it yet.
Okay, I can't say it yet. Garrett's not letting me do it yet. Okay, but I'll tell you what this. So you got to keep listening. See, tease. That's a tease. Make you listen. So talking about restoring digestive health, if you have a healthcare question, give us a call, 844-44-Dr. Joe. That number rings through to my offices when I'm not on the air. We said earlier that digestion starts when you think about food. It's called the cephalic phase, and the vagus nerve sends a message into digestive enzyme, into your organs, and the digestive organs then start producing the enzymes that you need. The gastric phase, this is about 60% of all your stomach acid, and that's when food hits your stomach and the stomach starts to swell. You have something in your stomach and your colon called stretch receptors. You have them in your muscles too. And basically it'll stretch to a certain point and then it'll release. And so when you eat, if you're eating a really strong fat and protein-based diet, which I'm not a big fan of, you don't have enough fiber in your diet. And the fiber causes the colon to swell. And when it swells to a certain point, it fires off these stretch receptors, and then it causes the colon to contract. And that's called moving your bowels. It's called peristalsis. And so when peristalsis occurs, a lot of it is because the stretch receptors are being fired. So when you eat food, it stretches the stomach and it breaks down the food into something called chyme, which is a mixture of digestive enzymes and the food. And if you ever threw up, that's chyme. Okay, it looks like that mushy mess together there. Now, that will cause the stomach to start releasing digestive enzymes. Now, it can also be triggered by too much alkalinity in the stomach if the stomach is diluted. Because if you dilute the stomach acid, like drinking a lot of liquids with a meal, wine, how many people like a glass of wine or two at their meal? Well, guess what? That's causing a problem because you're diluting your stomach acids. Too much water, diluting your stomach acids. Now, you can drink a little bit, maybe 4 or 6 ounces, but after that, you start diluting your stomach acids. The pH goes up, which means it's less acidic. I know that's confusing. Less acidic, and then the brain gets a message via the vagus nerve saying, we're too alkaline right now in the stomach, let's start producing more acid. So when you like to have a steak, well, you need a lot of acid to digest, and then you have a glass of wine, which is diluting your stomach acid, making it harder to digest. And I know you're going to get mad at me. I was talking to a friend of mine, and she said she doesn't eat a lot of meat, but her favorite thing is a steak and a glass of red wine. And I don't do that, so I guess that's good. But it's really messing up her digestive system. And then if you throw in a carbohydrate, so let's assume we have steak, which is a very heavy protein, takes a lot of acid to digest. And then you have a potato. Potato is very alkaline. It's a carbohydrate, and it doesn't need a lot of acid. It needs less acid or more alkalinity. And so now you have this heavy acid steak that might take about 6 hours to digest. And then you have a potato that might take 2 hours to digest. What does the stomach do? And then you drink wine, which can dilute the stomach acid and really throw everything off, and the body doesn't know what to do. And so now the carbohydrates sit in your stomach for too long, where they ferment. They actually can create an alcohol. And then the protein may pass into your small intestine partially digested, and then your pancreas has to start producing protease to break down the protein, the enzyme that breaks down protein. And now you're putting a strain on the pancreas. And then you wonder why you're sick, because you're really messing with your body. If your calcium levels are too low, if there's too little calcium in your blood, the body can raise the stomach acid levels to digest and absorb more calcium. See how complex this is? So folks, stop messing with it. Stop causing so many problems. Take care of yourself. You want to get a normally functioning nervous system, a normally functioning digestive system, and good nutrition. That's the core of a healthcare plan. You may have a health insurance plan, but you don't have a healthcare plan. Healthcare plan is the steps you want to take to get well and stay well. Folks, got to go to a break. If you have a healthcare question, 844-44-Dr.Joe, my website, drjoe.com. You can order supplements and books. You can read my blog. You can watch and listen to well over 1,000 hours of podcasts there. If you want to make an appointment in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We're a team of chiropractors and nutritionists. We want to help get you well and keep you well. And by the way, if you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time. So get to see us as soon as possible. Folks, I'm Dr. Joe Esposito, 844-44-Dr.Joe. We'll be right back.
If you're like most people, you have neck pain, back pain, shoulder pain, numbness, tingling, headaches. Maybe it's time to stop suffering and it's time to take action. If you're sick and tired of being sick and tired, why don't you come see me and my team of doctors, and let's see if you have a problem that we can help. Go to my website, drjoe.com, or call 844-44-Dr.Joe to make an appointment today, because so many of you are out there suffering needlessly, and we want to put a stop to that. Come see us at our offices in Marietta, Stockbridge, and Duluth. Make an appointment today so we can help get you well and keep you well.
Board's here to remind you it's
All right. So, one question that popped out to me, what about iodine? I use pink Himalayan salt and finishing salt from Mexico.
Mm-hmm.
Should I be concerned?
Yes. It's not enough iodine. Super Green's an essential source. See, I took years to formulate this for you guys. Super Green's an essential source, has sea vegetables in it. Super Greens has dulse in it. And the sea vegetables are excellent source of iodine. So another reason to take Super Greens an essential source every day is it's a great source of absorbable iodine. It's the organic form, meaning it comes from plants. The inorganic form is not something you absorb very well, and many times that's what they add to iodized salt. It's not a good form of iodine. It's a cheap form of iodine, chemically cheap. So, gosh, lots of callers all of a sudden.
Okay. Now, I can't ask you the straight-up flu question, but are you going to get a flu shot?
Nope.
Is anybody in your family going to get a flu shot?
Nope.
There's your answer.
I always say if you knew what I knew, you would do what I do. So, just do what I do.
Okay, now
if you want to get one, by the way, it's your choice. I'm not telling you not.
This is a big question for me as well.
You're using
Some
this
eat
person.
4 or 5 pieces of bread at Maggiano's.
I saw you do that. It's because you're young and you can get away with it. If I ate that, I'd be like 900 pounds. So.
Now, how do you wean off the carbs? It really is an addiction.
Yes, you're absolutely right. It is an addiction. It's not a joke. It is an addiction. Because when you eat sugar, it stimulates the nucleus accumbens in your brain. Nucleus accumbens releases dopamine. Dopamine gets you high. So you are an addict, and the same part of your brain that lights up when you eat sugar also lights up when you do heroin and cocaine. So yes, it is an addiction.
Is there a meeting I can go to?
Yeah, AA, CA, Carbohydrates Anonymous. The only way to do it is to do it. And what you need to do is cut out the carbohydrates. Now, I find that a lot of patients say this. They take the Super Greens, the essential source, and that helps tremendously with their carbohydrate problems because it helps stimulate the normal function of the brain. Get the bad food out of the house. Am I waving to somebody? Am I waving to? Okay.
They asked where Garrett was today since I've been talking. So
oh, Garrett's back here. He's here.
They were concerned.
He's here. Don't worry. I can't do shows without these guys. Come on. Yes.
Now, does the plant-based diet lead to lower blood pressure?
Usually, yes. Yes, and then you want to take Dr. Joe's nitric oxide as well. Nitric oxide opens up your blood vessels, and that helps with circulation. Remind me to talk about nitric oxide when we come back on the air, because I had to talk about that helping with digestion too, and I forgot. So.
Okay, and then what do you think about high pH water, specifically like the 9 and above?
The alkaline water. Here's the thing. I don't mind the high pH water. I don't mind the alkaline water. But if you're doing it to get healthy, you both. Because your body shouldn't need to be alkalized. It should be already alkalized from a good diet. So it's treating a symptom. It's not treating the cause. So alkaline water is not getting to the cause of the problem. It's just treating the symptom. Get on a plant-based diet. Stay away from alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, and pastas. And you won't need to alkalize your system.
All right, so there is a question about why can't you answer the real flu question, the real flu shot question?
Because I'm not a medical doctor and I can't give you medical advice. I can't tell you to take drugs or not take drugs.
Food for eyesight.
I have macular degeneration. And, oh, by the way, when you put together that slide presentation, I'm doing a big presentation next week, continuing education for, I don't know, several hundred doctors. And one of the slides we need to add to that PowerPoint are the pictures of my eyes, and I have them for you.
Okay. Cool.
I had macular degeneration. I was told by my eye doctor, you're going to go blind. That's it. It's pretty much is what it is. It may stay the same. It probably get worse, and it's used in your brain. 95% of the serotonin is used in your digestive system. So you were taking that medication to utilize the serotonin that you had more efficiently. That's basically what you take those SSRIs for. And so utilizing your serotonin more efficiently, 95% of the serotonin is used in your gut. When you came off that medication, what happened? The colitis flared up because you didn't have enough serotonin, so to speak. I'm trying to keep it simple here. And then they put you on steroids, which again, I'm not a medical doctor, the steroids can help shut down your immune system and bring down the swelling. But now what happens when you come off that? And so a couple of things we might want to consider. Number one is how can we either utilize the serotonin that we have, or what if we just make more serotonin? Well, there's a novel idea. Well, we do that by getting your digestive system working. It ties in beautifully today's show, by the way, because your stomach's job is to take proteins and break them into amino acids. The amino acid tryptophan combines with vitamin B6 and creates a chemical called 5-HTP. 5-HTP becomes serotonin. serotonin becomes melatonin, which helps you sleep. So I'm guessing you probably have some sleep issues too. Yeah, so there you go. I'm psychic. I read your diary, by the way, Sarah. So you got to hide it better. Next to the bed there, I found it right away. It was not a big deal. So she's worried now. She's looking around. How does he know where my diary is? So if we take the stomach and we massage it down away from the diaphragm, that's what is usually the core to this. Then we get you on some digestive enzymes, some really easy to digest foods like plants, fruits and vegetables, nuts and seeds. Then hopefully your body will break the proteins into amino acids and get you on a B complex as well, Dr. Joe's B complex, to start absorbing the tryptophan, and the B6 becomes serotonin, becomes 5-HTP, which becomes serotonin. And then we start building up those serotonin levels in the body, and that should help calm down the colon as well. Oh, good girl. Uh-huh. I know it. I know it. And that's the irony of it all. The high fiber will irritate the colon, but the reason you got the colitis is probably because you didn't have a high fiber diet. So, you know, like Elvis said, we're caught in a trap. So you're too young to get that reference. So, okay. Take the compliment, Sarah, and run with it. Yeah, so best thing would just come see us, and let's see if we can fix it physically, and then we'll get you digestive straightened out, and then hopefully we can get this whole thing taken care of for you. Thanks, Sarah. Appreciate the call. Let's see. We got to go to a break pretty soon. So if you're on hold, Linda and everybody else, if you're on hold, keep holding. We're going to get to you when we come back.